Imagine someone very close to you has just suffered a heart attack and needs to go under open heart surgery to repair the damage. Or your best friend has just been diagnosed with leukemia and is going to have to take regular blood transfusions. It's not very pleasant to think of these instances, but unfortunately these things happen every day. You may have already experienced them yourself, or you know someone who has. Naturally, you would assume that hospitals near you have all the resources to facilitate people's return to good health. Transfusion of red blood cells, platelets, and plasma are very critical to return someone to good health and are vital for for saving people's lives in emergency situations. Some examples of people who would need blood transfusions would be, well, not blood transfusions, would require blood, would be burn victims, accident victims, surgical victims, or patients, as well as people suffering from leukemia, cancer, kidney disease, or liver disease. The demand for blood continues to outstrip the ability to collect it, and if this continues, we're going to have a severe problem with not having enough blood for procedures that patients need. According to the Canadian Blood Services, approximately every minute and every day, someone in Canada needs blood. In fact, according to a recent poll, 52% of Canadians say they or a family member has recently needed blood or blood products for medical treatments or surgery. Think about your blood type. There are 4 major blood groups. There's A, O, B, and AB. This is then divided into negative and positive. The most common blood type is O positive. 39% of Canadians have this blood type. And the rarest blood type is AB negative. Under 1% of Canadians are said to have this blood type. A person with type O blood is considered to be a universal donor because they can donate to anyone. However, they can only receive blood from people who have O blood type. AB negative, or AB blood, is said to be the universal receiver. So they can receive blood from anyone but can only donate to people who have their blood type. So you're probably thinking, how much blood does it take to save a life? Here are some examples I pulled from the Canadian Blood Services website. A liver transplant takes up to 100 units. An auto accident victim takes up to 50 units, and a fractured hip or joint replacement takes up to 5 units. As you can see, blood is desperately needed in situations like these. Naturally, you would want to do everything you could to help someone close to you who is in need. There is one way you can help, and that's by donating blood. 1 unit of blood is equal to 1 donation and half a liter, and each adult has about 5 liters of blood within their body. Giving blood is simple, yet it is immensely helpful. Anyone who is at least 17 years of age, 110 pounds, and is in good health is usually able to donate blood. So at the time of donation, you will go through a screening process. You will have a hemoglobin test, which is your iron. You will have a blood pressure and temperature check, as well as you will do a completion of a questionnaire that determines your eligibility. The questions on this questionnaire will be based on past illnesses, dental work, tattoos and piercings, sexual history, as well as questions based on travel experiences or countries you've recently traveled to. The donation process from time you arrive to time you leave is 1 hour. The donation itself is only 10 minutes, and all the blood that leaves your body is replaced within 24 hours naturally, and then the red blood cells that you lose are replaced within 10 days. So there are many benefits to donating blood on a regular basis. In addition to helping save lives, you are also receiving physical benefits to being a regular donor. If you donate blood several times a year, you are likely to be in better shape than people who don't donate blood. You will also have reduced risk for several severe diseases. When you donate blood, you are lowering your iron levels in your body, which helps you reduce risk of heart disease. You are also lowering your risk of cancer. So according to the Canadian Blood Centre, consistent blood donation is associated with lowered risk of cancer, including liver, lung, stomach, colon, and throat cancers. You can also improve your cardiovascular health. according to the Florida Blood Services, they say that regular blood donors have an 88% lower risk of heart attacks and a 33% lower risk of severe strokes. Your body replenishes its blood every time that you give blood, and it's been proven that the replenishment process actually keeps your body more healthy and works more efficiently. You are also able to check up on your health every time you go in to donate blood. So instead of going in for regular checkups at your clinic, you will be with a healthcare provider while giving blood, where you will be able to check your pressure, your pulse, as well as vital signs to indicate your health. It upsets me that unfortunately I can't receive any of these benefits because I have had malaria before. So when I was in Africa last summer, I contracted the malaria virus. This is one of the questions you would be asked on the questionnaire, which you are actually able to download on the website of Canadian Blood Services. You can check up on the questionnaire. But one of the questions would be if you have ever been in a malaria zone. So people who have been in a malaria zone for 6 consecutive months can not donate for 3 years. People who have been in a malaria zone for under 6 consecutive months can donate in a year, and people who have ever contracted malaria can never donate. So that's why I'm asking you guys to donate blood. I'm unable to donate blood, and it's really sad. So I'm asking you to please donate. If you have the travel bug like I do, donate before you go somewhere that has a malaria zone. Because you never know what will happen during your travels. I was taking anti-malaria drugs, and I still got it. So you never know what's going to happen. There's been some negative stigma around donating blood, but it's perfectly safe. It poses no health or risks to donors. It is impossible to contract HIV or AIDS or any infectious diseases. They use a disposable sterile needle, and it is discarded after each donation. There is the Beban Park Social Center, which I looked up on Bowen Road. That is available for walk-ins as well as appointments. You can enter in a refined search on the Canadian Blood Donor site with certain specific dates that you want in your area, and it will pop up certain places that are accepting appointments and walk-ins. I found that the Mount Benson Elementary School on Jinglepot is having an open donation for the public in 60 days. So if you guys want to donate, that'd be a great place to do it soon. And so it's safe, it's simple, and most importantly, it can save someone's life. By donating blood to ensure there is enough in supply, you may be saving your own. I will take any questions if anyone has any. Thank you.
So I'm curious why you wanted to do this topic.
Because I found out that I'm not able to donate blood anymore, and it really bothers me because it's actually on my bucket list. I have a bucket list, and I can't do it now. So that kind of makes me upset, and I was thinking, like if I knew this beforehand, I would have donated before I went, but I just wasn't educated on it. So I'm just trying to say that it's needed, and if people can donate, you should donate. You never really know, maybe you'll need blood one day and you'd be paying it forward.
You say like Canada's supply of blood. Do you know how much is like actually used, or do we need?
No, but they're saying, like I was reading the poll, that at least every minute of every day someone in Canada needs blood. So just putting it in that perspective, it's desperately needed every day. So.
Is there a particular type that like Canadian Blood Services is currently looking for specifically?
Well, O blood is a universal donor, so that can be given to anyone. So that is what is in most need. But you can actually check your blood. I don't know if you guys know your blood type, but you can go into any clinic and just ask for your blood type. You actually have to ask for it. Like when you get tested for iron or anything, they usually don't tell you your blood type. You have to ask them to make sure that you know it. So, but O blood type is universal donor, so that's what's most needed.
So they don't come to the university, like, and set up in the cafeteria and do blood drives or anything like that?
You know what, I don't know the answer to that, I can definitely check into it, but when I was looking, online, it was a lot to do with like elementary schools and high schools and other clinics, but I never saw VIU on there. But they might do it.
I like that stuff, you guys do this.
Yeah, it'd be a good thing if they did, I'd like to,
Any more questions from you guys?